5 facts you have to know about cancer. 1. When cancer spreads from a primary tumor to another part of the body, it's still that original type of cancer. If a patient with breast cancer, for example, has cancer cells break away from their original tumor and spread to their liver, brain, bones or lungs, a process known as metastasis, she or he is still considered to have breast cancer rather than liver cancer, brain cancer, or any other type of cancer. This distinction is important because cancers that start in breast tissue have different characteristics than cancers that start in liver or lung tissue. Doctors make treatment decisions based on the characteristics of a patient's primary tumor type, as well as the unique characteristics of the patient's individual disease. 2. New immunotherapy treatments, which help the body's own immune cells detect and attack cancer, have shown great promise. But they're not a magic bullet. In recent years, the cancer treatment world has been abuzz about immunotherapy. And it's shown many promising results, especially in combination with chemotherapy, doubling the median survival time for patients with lung cancer in one clinical trial, for example. But patients should understand that immunotherapy treatments are not appropriate for every situation. The appropriateness of immunotherapy depends on the type of cancer and the features of an individual patient's disease. Yes, immunotherapy is new and exciting and has opened new possibilities in the field of cancer care, says Kim Zapper, R. A nurse with the Rogel Cancer Center's Cancer Answer line. But in spite of successes for specific types of cancer, there is a lot of work still to be done in the laboratory and through clinical trials. Three. Delays in lab results and in formulating a treatment plan can be frustrating, but in most cases taking the time to make a considered plan won't affect outcomes. It can be difficult to wait for lab results, to find out if you or a loved one has cancer or whether a previously treated cancer has returned. And although fear, anxiety and other emotions might be running high, this is normal. And when results do come back, there may be a desire to start attacking the cancer right away. But it's also important to begin treatment with a clear, informed treatment plan, which may include additional tests, or even a second medical opinion. 4. Seeking a second opinion can be helpful. Whether you're at a medical crossroads or considering a change in the course of treatment, your doctor should be open to considering options both locally and at other cancer centers. In the end, the decision to change treatment teams or centers is your call. A second opinion can often be a valuable part of your cancer treatment, says Michael Sobel, M. The William W. Kuhn Collegiate Professor of Surgical Oncology in the Department of Surgery and Chief of the Division of Surgical Oncology at Michigan Medicine. Today, there are multiple treatment options available. Different institutions, different doctors have different approaches. Sometimes having a second set of eyes on radiology images and pathology reports can be critical to determining what's going to be the best treatment for you. Five. The stage of a patient's cancer at the time of diagnosis is a critical piece of information. A cancer stage is a label given at the time of diagnosis that describes the extent of a patient's cancer and how far it's spread into nearby tissues and lymph nodes. A cancer stage is a key factor